educate people on the topic we have at hand this morning.
Okay, so today we're talking cervical cancer. Cervical cancer is quite a menace. It's quite It's quite the life-threatening and devastating thing. It has taken away mothers from babies. It has taken away wives from their husband. It has taken away sisters from their family or children from their family. And this is something that we've seen happen so much in recent times. In fact, the statistics are alarming. And this being the awareness month for cervical cancer across the world, it is necessary that we get into this particular conversation on health and wellness. So we care about the ladies. If you're a lady out there, please get a notepad. You need to write things down. If you're a gentleman out there, you love the ladies in your life, I think you need to do the due diligence of putting things together for them. Now let's start out having this conversation with you, and I think I want to start with the very basic question for those who are listening and for those who might not even know that there is something called cervical cancer. What would you describe cervical cancer as? What are the symptoms of cervical cancer?
Okay, so before we go into that, big ups to Super FM for thinking about this. It's Cervical Cancer Awareness Month, so it's important to spread awareness.
It's cervical, not cervical.
Cervical.
It's cervical. Okay, so cervical cancer.
So it's basically cancer of the cervix.
Oh, so it's actually pronounced cervical cancer.
Yeah.
Thank you very much for the correction.
Okay, so like you asked, how would I describe cervical cancer? Cervical cancer is the second most common cancer in the world today, affecting women after breast cancer.
Wow.
The statistics, like you said, are alarming. Only in Nigeria alone, annually we have about 12,000 new cases.
Wow.
And the mortality rates, there's a number of people that die from it, are up to 8,000 every year.
Wow.
But the
12,000 cases every year, 8,000 mortalities.
Yeah.
Wow.
So the prognosis is not so great because you can't exactly know that you have cervical cancer at the beginning. It's asymptomatic. There are no symptoms at the beginning. So at the time symptoms start to show, then the disease is already at a later stage, and then the successes for treatment at that time is really, really very, 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 chances is slim at that time.
So we can call cervical cancer, I beg your pardon, we can call it the silent killer.
Well, there are a lot of silent killers.
It is, because if we said 12,000 cases and 8,000 mortality rate, that's huge. And for something that is asymptomatic, which you will not find any symptoms at the early stages, which means you can have it for months or even years and nobody knows anything. It's just, when you start seeing the symptoms, it's already too late. Okay, so now that you've established this fact, ladies, there are some things that you must know. So what causes cervical cancer? Okay,
so about 99% of cases are caused by HPV infection. HPV is human papilloma virus. So coming in contact with that virus is sexually transmitted. Coming in contact with that virus puts you has a lot of strains, but there are about 2 or 3 major strains that are known to cause cervical cancer. Some of them will cause warts. Some of them cause other types of cancers like anal cancer, throat cancer, and all that. But the strains that cause the cervical cancer are asymptomatic. Once you start to see warts, that's not the strain that causes the cervical cancer, but that also puts you at risk of developing cervical cancer. So,
wow. Okay.
Only about 1% of cases, in rare cases, will not be caused by HPV infection. Maybe genetic factors and the way the cells are just proliferate by themselves. But those ones will happen in very, very rare cases. So.
Okay, so let's now talk about, you've talked about the HPV, which is the major cause, and you said there are rare cases that are not caused by the HPV. Now, let's look at something else that is a little bit more pressing. How is this diagnosed? How is cervical cancer diagnosed? What are the diagnoses? What are the things that and are there things that as a young person or as a woman you should start to do for yourself? I know that there was a lot of awareness, that there is a lot of ongoing awareness about the likes of breast cancer. There's I'm not a woman, self-breast examination, standing in front of your mirror and doing some of these things that I'm doing right now. And all of those things, and they're interactive. People have given their life's work. In fact, I was just talking about a particular individual in Cameroon who has done some work, a medical doctor who has done some work teaching young girls and women, just yesterday, about breast cancer. But maybe there seems not to be a lot of awareness about cervical cancer. Of course, the first time I heard about cervical cancer was in 2011 or thereabouts when I had someone do a research for a radio program on it. But then hearing about it and knowing about the diagnosis, how is it diagnosed? Let's talk about that.
Okay, so early detection is key. So it's important that women do what they call pap smear. Always go for screenings. Always go for. In fact, once you are sexually active, it's important to always go for screenings. The pap smear is most NGOs do it for free, and most health organizations will also do it for free.
Yeah.
But in some cases, it may be paid, and it's always worth it. I would advise that women take a pap smear once every. You could do it annually. You could do it by identify precancerous cells, even cancer cells. So the pap smear is very, very important.
Very important to do the pap smear. Now, aside the pap smears and all those other things, the CTs, MRIs, and all those PET scans, of course, could you elaborate on some of these conversations? Because a lot of people do not necessarily understand some of those intricate terms. I just, of course, from hearing people talk about it, and when I hear this thing, okay, so I think my dad had to do a CT scan at some point when he was about to get a procedure done on him, and that opened my mind to it. But then Nigerians are thinking, oh, this thing must be really very expensive. But like you mentioned just now, NGOs do it. Some NGOs do it for free. Let's elaborate some more on some of the processes of this entire pap smear, CTs, and the likes.
Okay, so on the average, you could do a pap smear for about 35,000 naira. There are some health firms that also have some self-testing kits. You could just purchase from a pharmacy, and then all you need to do is put in the testing kits in the vagina, and then
okay.
So what the kit will do, or what they do in a pap smear basically, is to it's just like getting a swab of the cells in and around the cervix. So, and then they take it to a lab and do proper testing on them. So if there are cancerous cells there or precancerous cells, it can be identified. So it's not expensive. If you want to consider the amount of money you would spend if you develop cervical cancer, honestly, to getting a pap smear is not expensive.
Okay, and you said at least 2 or 3 or 4 times a year.
No, at least once a year is
Once a
okay.
year, okay.
Once, some people could go biannually, but as much as possible,
Once a year.
as much as often is
Now,
better.
you talked about this being sexually transmitted. Do any of the protective, of course, using protective alternatives, like, okay,
Using a condom.
and the likes, does it protect you from?
Yeah, there are some strains of cervical cancer that of human papilloma virus that are spread via contact, just via contact. So wearing a condom may not even exactly help. But I would always advocate that protected sex is what people should do. Wear a condom, if possible. Have one partner. Let your partner have one partner, and that is you. Because being monogamous, you are monogamous. Do you know if your partner is
for the next person?
Exactly. Yeah. So, but having one partner is okay. Is best. Abstinence is okay if you are not. If you don't have any need to.
If you're not married, definitely,
yes,
that's what we preach at Super FM. If you're not married, why go do? Exactly. Now, it's interesting that you mentioned this, and we also talked about the fact that cervical cancer is most times the HPV is something that is carried by men. I've heard that in some quarter. You could clarify that for me right now. That is something that men carry, but has not much of an effect on the men themselves. Men do not suffer from cervical cancer. But does the HPV itself have any effect on the men that are carriers of this particular virus?
Of course. So anybody can be a carrier of HPV, man, woman. Now, there are different strains, more than 9 strains of the virus. And then you have different strains will cause different things. Yeah. There's a strain that causes cervical cancer. Okay. There's a strain that causes genital warts. Genital warts can happen in anybody, men or women. Strains that cause bladder cancer, throat cancer. These days there's also oral sex going on, so people can develop these things. So once you have, and nearly all sexually active people will come in contact with HPV. Wow. So in their lifetime, so it's important that people get vaccinated or practice safe sexual practices.
Okay. So of course, talking about prevention, we've talked about we've talked about the diagnosis, the prognosis, and you talked about the prognosis being something that is very dire. Since we have 12,000 cases, new cases every year, 8,000 in mortalities. That's when it comes to cervical cancer. I beg your pardon. What are the main treatments for cervical cancer? What are the main things that you can talk about? Okay, when it comes to treatment of this particular ailment, at the stage when it's still, maybe you've done a pap smear or something, and you see that there are probably some things that are hinting towards this particular condition. What are the things that could be done to mitigate it and see to it that we have a less mortality rate?
Okay, so the outlook for cervical cancer is, like you said, is dire, but at early stage, if diagnosed early, it's treatment.
How early is early?
Well, if you go for a pap smear and they can see precancerous cells or cancerous cells, I think that's early enough, and there are no symptoms at that point.
So you can't say maybe 3 months, 2 months, 1 month,
because we cannot exactly pinpoint the time you got infected.
Yeah.
So,
okay.
But like once you don't have any symptoms and your pap smear results show some cancerous cells and you don't have any symptoms, it's important that at that point, if you go for a treatment, your success rate is high. So treatments such as there are oncology drugs, there's radiation. There, in some cases, they may have to take out cancerous cells via surgery. So, but meeting a doctor, getting in touch with a doctor is very important. Don't self-medicate.
Yeah.
You can't self-medicate. And don't just walk into a pharmacy and tell them
take
to
antibiotics
give you. No, it doesn't work that way. So, but like in cases where, from stage 2 to stage 4, where there are symptoms already, such as postcoital bleeding, maybe bleeding after sexual intercourse, or you're having increased urinary frequency, or
abnormal bleeding during your period,
or abdominal pain and all that stuff. The prognosis may not be so great at that point because there are already symptoms. But in many cases, people have responded to treatments very well. And it also depends on the immune system of the person. Does this person eat good food? Does this person have other comorbidities such as HIV? Does this person smoke or take alcohol? There are some other factors that would affect success rate of treatment. So is this patient healthy? If this patient is healthy, and then we can also say that success rates will be high. So there are other factors.
Well, we're having quite the conversation, and I'm sure Lagos is listening right now. They want to be a part of this conversation. If you'd like to send in a question via WhatsApp, 0705 69000927 is the number to send your WhatsApp messages to. If you want to do a phone call, you can call 0805 092 0927. We've got about 10 minutes to go on the show, and I would love to hear from you. We're going on a quick break right now. This one is Kwam1 and Nice coming in with quite the song Health is Wealth. Remember that while we're on the break, you can send in your messages 0705 69000927. And in case you just joined in and you're wondering, oh my God, they're talking cervical cancer, I've missed so much. Please, you can actually watch the episode again on YouTube at Super FM Lagos. This episode, the entirety of it is live there on YouTube, and everything you need to know. And of course, before we end the show, we'll be giving out the Instagram handles of the pharmacist with us in the studio today. Stay tuned. We'll be right back. Okay, someone is trying to reach us. Should we take this call real quick? Let's see who this is. Hello, good morning. Hello? Hello? Okay, please just do call us back. We'll be going on that quick break. When we come back, I'll still be here.